Hello and very warm welcome to all the enthusiastic learners joining us today. Today we are going to further explore therapeutic devices. Definition of therapeutic devices. Therapeutic devices refer to a diverse range of medical instruments and tools designed to assist in the treatments, management and rehabilitation of various health conditions. These devices are specifically engineered to deliver therapeutic interventions that aid in restoring or improving a patient's health and well-being. They encompass a wide array of technologies from simple devices like heating pads to complex systems such as robotic surgical platforms. Therapeutic devices play a crucial role in enhancing patient outcomes and quality of life by offering targeted and effective treatments across a spectrum of medical specialties. Importance of therapeutic devices in healthcare. The significance of therapeutic devices in healthcare cannot be overstated. They contribute to numerous aspects of medical practice, including diagnosis, treatment and monitoring. These devices enable healthcare professionals to provide more precise and tailored therapies to patients, optimizing the healing process and minimizing adverse effects. By integrating technology and medical science, therapeutic devices have revolutionized the medical landscape, making once complicated treatments more accessible and manageable. Types of therapeutic devices: invasive versus non-invasive devices. Therapeutic devices can be broadly categorized into two main types, invasive and non-invasive. Invasive devices involve the penetration of the body's natural barriers such as the skin or mucous membranes. These devices are typically used for interventions that require direct access to internal structures or organs. Example of invasive therapeutic devices include surgical instruments, catheters and implants. In contrast, non-invasive devices do not breach these barriers and are applied externally to the body. They are particularly favored for their lower risk of complications, reduced recovery times and ease of use. Non-invasive devices encompass technologies like external stimulation devices, wearable monitors and external prosthetics. Active versus passive devices. Another way to classify therapeutic devices is based on their mode of operation, active and passive. Active devices are those that require a power source to deliver their therapeutic effect. These devices often involve electronic components or mechanisms that actively generate and control the desired therapeutic action. Examples of active therapeutic devices include electrotherapy units that deliver electrical stimulation and infusion pumps that precisely control the administration of medications. On the other hand, passive devices do not rely on external power source and instead rely on natural processes or forces to achieve therapeutic outcomes. Devices like heating pads, cold pads and compression garments fall under the category of passive therapeutic devices. Classification based of treatment approach. Physical therapy devices. Physical therapy devices encompass a range of tools designed to facilitate the recovery and rehabilitation of patients through targeted physical interventions. These devices aim to improve mobility, restore functionality and alleviate pain. They can be further categorized into subtypes based on the type of therapy they provide: heat therapy devices, cold therapy devices, electrotherapy devices, drug delivery devices. Drug delivery devices play a crucial role in administering medications in controlled and targeted manner. These devices ensure that patients receive the right dose of medication at the right time, optimizing treatment outcomes and minimizing side effects. Some common drug delivery devices include infusion pumps, inhalers and nebulizers, insulin pumps, surgical and interventional devices, catheters and stents, robotic surgical systems. Now, we discuss physical therapy devices, heat therapy devices. Heat therapy, also known as thermotherapy, involves the application of heat to the body to promote relaxation, improve blood circulation and relieve pain. Heat therapy devices utilize various methods to deliver controlled heat to targeted areas. Heat pads. These are portable, flexible pads that generate heat using electricity. They are commonly used to alleviate muscle tension, reduce stiffness and promote relaxation. Infrared lamps. Infrared radiation penetrates the skin, warming the underlying tissues. Infrared lamps are used to provide deep heat therapy, often for conditions like joint pain and muscle injuries. Cold therapy devices. Cold therapy or cryotherapy involves the application of cold to reduce inflammation, numb pain and promote healing. Cold therapy devices employ different mechanisms to deliver controlled cold to specific areas. Cold packs. These are gel filled packs that are cooled in freezer and then applied to the body. Cold packs are often used to reduce swelling and relieve acute pain. Cryotherapy units. These devices deliver localized or whole body cold therapy by using controlled cooling technologies. They are employed for conditions like sports injuries, arthritis and post operative recovery. Electrotherapy devices. Electrotherapy devices utilize electrical stimulation to target nerves and muscles, offering pain relief, muscle strengthening and even promoting tissue repair. Now, we discuss overview and mechanism of heat therapy devices. Heat therapy devices are essential tools in the field of physical therapy, offering a non-invasive method to alleviate pain, relax muscles and improve blood circulation. The underlying mechanism involves the application of controlled heat to targeted areas of the body. This heat increases blood flow, causing blood vessels to dilate and enhancing the delivery of oxygen and nutrients to the tissues. Heat therapy also helps to reduce muscle tension, increase flexibility and smooth discomfort. The choice between different heat therapy methods depends on the specific condition being treated, the depth of heat penetration required and patient preferences. Examples: heating pads, infrared lamps. Now, we discuss to overview and mechanism cold therapy devices. Cold therapy devices, also known as cryotherapy devices, are instrumental in providing a non-invasive approach to manage pain, reduce inflammation and facilitate the healing process. The device apply controlled cold to the body, which causes blood vessels to constrict, reducing blood flow and decreasing tissue metabolism. Examples: cold packs, cryotherapy units. Now, we discuss electrotherapy devices and their overview of electrical stimulation. Electrotherapy devices utilize controlled electrical impulses to stimulate nerves and muscles, resulting in therapeutic effects. These devices have gained prominence in rehabilitation and pain management, offering non-invasive interventions with applications ranging from pain relief to muscle rehabilitation and strengthening. The underlying principle involves modulating the electrical signals within the body to achieve specific outcomes. Purpose and mechanism of inhalers and nebulizers. Inhalers and nebulizers are essential devices for delivering medication directly to the respiratory system. They are commonly used to manage various respiratory conditions, providing quick relief and targeted therapy. Inhalers. Inhalers are also known as metered dose inhalers or dry powder inhalers, are handheld devices that are deliver medication in the form of an aerosol spray or dry powder. When the patient inhales, the medication is dispersed into the lungs. Inhalers are particularly useful for conditions such as asthma, chronic obstructive pulmonary disease and bronchitis. Nebulizers. Nebulizers are devices that convert liquid medication into a fine mist that can be inhaled directly into the lungs. The patient uses a mouthpiece or mask to inhale the medication over a period of several minutes. Nebulizers are often used for patients who may have difficulty using inhalers, such as young children, elderly individuals or those with severe respiratory distress. Now, we discuss to mechanism of insulin pumps. Insulin pumps are small wearable devices that deliver insulin continuously and in precise doses throughout the day. A small catheter or cannula is inserted under the skin, usually in the abdomen, and remains in place for a few days. The pump is programmed to mimic the body's natural insulin secretion with basal rates for steady insulin delivery and bolus doses for mealtime coverage. Advantages over traditional insulin delivery: improved glycemic control. Insulin pumps offer more precise control over insulin delivery, allowing patients to fine tune basal rates and bolus doses to match their individual needs. This leads to tighter blood sugar control and reduced risk for hypoglycemia and hyperglycemia. Flexibility and convenience. Pumps provide greater flexibility in meal, timing and physical activities. Patients can adjust their insulin delivery based on their lifestyle, improving adherence to the treatment plan. Now, we discuss to fewer injections. Insulin reduce the number of injections required daily. Instead of multiple injections, patients need only to change the infusion set every few days. Customization. Patients can program different insulin delivery profiles for various situations such as exercise, illness or specific meal times. This customization enhances individualized diabetes management. Reduced severe hypoglycemia. Insulin pumps with continuous glucose monitoring integration can help prevent severe hypoglycemic events by suspending insulin delivery when blood sugar levels are too low. Better quality of life. Insulin pumps enable individuals to live more normally by reducing the burden of frequent injections and blood sugar monitoring. Now, we discuss to data tracking. Many modern insulin pumps allow data tracking and sharing, aiding healthcare providers in analyzing trends and making informed adjustments. Now, we are going to surgical and interventional devices. Overview of surgical devices and interventional devices. Surgical and interventional devices encompass a range of instruments and technologies designed to facilitate medical procedures, surgeries and interventions. These devices play a crucial role in diagnosing, treating and managing various medical conditions, often providing less invasive alternatives to traditional open surgeries. Catheters and stents. Catheters and stents are commonly used surgical and interventional devices in various medical specialties. Catheters are the thin flexible tubes that are inserted into the body to deliver fluids, medications or perform various diagnostic or therapeutic procedures. They can be used in blood vessels, urinary tract, digestive system and other body cavities. Some common types of catheters include central venous catheters used for delivering medications, fluids and nutrients directly into large veins, often in critical care setting. Urinary catheters used to drain urine from the bladder, commonly employed in patients with urinary retention or surgery. Cardiac catheters utilized to diagnose and treat heart conditions by accessing blood vessels within or around the heart. Stents. Stents are small expandable devices placed in blood vessels, ducts and improve blood flow or maintain the patency of passages. Some examples included coronary stents, vascular stents. Now, we discuss to robotic surgical system. Robotic surgical systems are advanced technology platforms that assist surgeons during minimally invasive surgeries. They offer enhanced precision, dexterity and visualization compared to traditional laparoscopic techniques. Mechanism. Robotic system consists of a surgeon console with hand and foot controls and robotic arms equipped with surgical instruments. The surgeon controls these instruments from the console, translating their movements into precise actions inside the patient's body. Applications. Robotic surgery is employed in various specialties such as urology, gynecology and general surgery. It allows for minimally invasive procedures with smaller incisions and faster recovery times. Types of catheters: diagnostic versus therapeutic. Now, we discuss to diagnostic catheters. Diagnostic catheters are used primarily for obtaining diagnostic information about a patient's condition. They are equipped with imaging tools such as cameras or sensors to visualize internal structures. Some example included angiographic catheters used to visualize blood vessels by injecting contrast dye and capturing X-ray images. They are often employed in angiography and interventions like angioplasty. Endoscopic catheters employed in endoscopy procedures. These catheters carry tiny cameras to examine the inside of hollow organs like the digestive tract. Therapeutic catheters. Therapeutic catheters are designed to perform specific treatments or interventions. Now, we discuss to stents for vascular and cardiac applications. Vascular stents. Vascular stents are devices used to maintain the patency of blood vessels and prevent blockages. Vascular stents are used in conditions like coronary artery diseases. Coronary stents are placed in narrow coronary arteries to improve blood flow, reducing the risk of heart attack. peripheral artery disease. Peripheral stents can be used in arteries outside the heart such as the legs to treat blockages and restore blood flow. Cardiac stents. Cardiac stents are specialized stents designed for cardiac applications, particularly in coronary arteries. They are crucial in treating conditions like acute myocardial infarction. Stents are often used to treat blockage in coronary arteries during a heart attack, restoring blood flow and preventing further damage. Stable angina. Stents can relieve chest pain by improving blood flow to the heart muscle. Now, we are discuss about mechanism of robotic surgical systems. Robotic surgical system consists of a surgeon console and robotic arms equipped with surgical instruments. The surgeon sits at the console and controls the instruments movements using hand and foot controls. The robotic system translates the surgeon's motions into precise, scaled movements of the instruments inside the patient's body. Advantages of enhanced precision and control: reduced trauma, improved visualization, enhanced dexterity, tremor, filtration, ergonomics. Now, we going to applications of robotic surgical systems. Robotic surgical systems are employed across various surgical specialties including urology, gynecology and general surgery. Now, we are going to discuss patient safety and device reliability. First, device safety. Ensuring patient safety is paramount when using therapeutic devices. Factors to consider include design and manufacturing. Robust design, quality manufacturing and rigorous testing are essential to minimize malfunctions and defects. User training. Proper training for healthcare professionals and patients is critical to prevent errors in device operations. Adverse events. Monitoring and reporting adverse events is essential for identifying safety concerns and improving device performance. Now, we discuss to regulatory compliance. FDA means Food and Drug Administration. In the US, the FDA regulates therapeutic devices to ensure their safety and effectiveness. Devices undergo rigorous pre-market testing and post-market surveillance to maintain their safety profile. CE marketing. In the European Union, the CE marketing indicates compliance with EU regulations, signifying that devices meet safety and performance standards. Other regulatory bodies. Different countries have their own regulatory bodies that oversee medical devices, and compliance is essential for market access. Ethical and legal aspects. Informed consent. Patients must be fully informed about the benefits, risks and alternatives of therapeutic devices before treatment. Data privacy. Many devices collect patient data for monitoring and adjustment. Ensuring patient data privacy and compliance with regulations like HIPAA, Health Insurance Portability and Accountability Act is crucial. Equitable access. Ensuring that patients of all backgrounds have access to beneficial therapeutic devices is an ethical consideration. Legal liability, clear communication and proper use of devices help mitigate legal issues related to device malfunctions or adverse events. Now, we are discussed to integration of artificial intelligence and machine learning. Advances in data analysis, AI and machine learning are being integrated into therapeutic devices to analyze large volumes of patient data, providing insights into treatments, effectiveness and trends. Predictive analytics, these technologies can predict patient responses to treatments, enabling healthcare professionals to make more informed decisions. Real time monitoring, AI driven algorithms can continuously monitor patient data and provide alerts for anomalies or deteriorating conditions, allowing for early interventions. Decision support, AI can assist healthcare professionals in choosing the most appropriate treatment strategies based on patient data and medical history. Personalized medicine and customization, tailored treatment plans. Therapeutic devices are being designed to deliver treatments that are tailored to individual patient needs, optimizing efficacy. Genetic information, genetic data can be integrated into treatment decisions, allowing for personalized interventions based on a patient's genetic makeup. Biomarkers, devices can detect biomarkers in real time, enabling personalized treatment adjustment for conditions like diabetes and cancer. Patient engagement, customized treatment plans enhance patient engagement as patients feel more invested in their own care. Improved outcomes, personalized treatments can lead to better patient outcomes, reduced side effects and increased patient satisfaction. Now, we are going to real life examples of successful therapeutic devices applications. First, deep brain stimulation for Parkinson's disease. Device, implantable neurostimulator with electrodes. Applications, DBS is used to treat symptoms of Parkinson's disease by delivering electrical impulses to targeted areas of the brain, alleviating tremors, rigidity and bradykinesia. Impact, DBS significantly improves quality of life for Parkinson's patients, allowing them to regain control over motor functions. Second, artificial pancreas for type 1 diabetes. Device, closed loop system compromising an insulin pump and continuously glucose monitor. Its application, the artificial pancreas automatically adjusts insulin delivery based on real time glucose levels, reducing the risk of hypoglycemia and hyperglycemia. Impact, improved glucose control and reduced diabetes related complications for patients with type 1 diabetes. Third, the Vinci surgical system device, robotic surgical system with multiple arms and a surgeon console. Its application, the Da Vinci system is used for minimally invasive surgeries in various specialties, enabling enhanced precision 3D visualization and minimally invasive procedures. Impact: reduced pain, shorter hospital systems and quicker recovery times for patients undergoing complex surgeries. Fourth is drug eluting stents for coronary artery disease. Device: stent coated with a drug to prevent restenosis, re-narrowing of the artery. Application: these stents are placed in coronary arteries to improve blood flow and prevent blockages after angioplasty. Impact: reduced risk of revascularization and improved outcomes for patients with coronary artery diseases. Fifth, wearable insulin pumps for diabetes management. Device: a small wearable insulin pump. Its application: these pumps provide continuous subcutaneous insulin infusion, offering better glucose control and flexibility in insulin dosing. Impact: enhanced quality of life, reduced need for frequent injections and improved blood sugar management for diabetic patients. Now, we are going to advancements in material sciences. Smart materials. Future therapeutic devices may incorporate smart materials that respond to changes in the body, such as pH, temperature or glucose levels. These materials can enhance the device's functionality and adaptability. Biocompatibility. Advances in material science enable the development of biocompatible materials that minimize the body's immune response and reduce the risk of rejection or. Now, we are discussed to biodegradable materials. Biodegradable materials may be used in temporary implants, allowing the device to degrade naturally after fulfilling its purpose, reducing the need for removal surgeries. Next, nanotechnology and microfabrication. Nanomedicine. Nanotechnology offers the potential to create therapeutic devices and drug delivery systems at the nanoscale. Nanoparticles can target specific cells or tissues, enhancing treatment precision and reducing side effects. Microfabrication. Microfabrication techniques allow for the creation of miniaturized devices with intricate structures. Micro devices can be implanted or used externally for various therapeutic applications. Lab on a chip. Microfluidic devices or labs on a chip are designed to replicate laboratory processes on a small scale. These devices enable rapid diagnostic testing and personalized treatment approaches. Now, we are discussed to importance of biomedical sensors in therapeutic devices. Role of sensors in monitoring and feedback. Real time monitoring. Biomedical sensors play a crucial role in therapeutic devices by providing real time data on a patient's physiological parameters. This enables healthcare professionals to monitor patient conditions and make informed decisions. Continuous feedback. Sensors offer continuous feedback on vital signs, allowing for early detection of changes or abnormalities. This is particularly valuable in critical care settings and post-operative monitoring. Closed loop systems. Sensors can be integrated into closed loop systems, where the device responds to sensor data to adjust therapy parameters. An example is an insulin pump that adjusts insulin delivery based on glucose levels. Examples: temperature sensors. Now, what is the purpose? Temperature sensors monitor body temperature, which is an important indicator of health and can help diagnose and manage various conditions. What is its applications? Fever detection. Temperature sensors are used to detect fever, which could indicate infection or other health issues. Thermal comfort. In wearable devices, temperature sensors can help ensure patient comfort and prevent overheating. Hypothermia prevention. In surgical procedures, temperature sensors can monitor body temperature to prevent hypothermia. Now, we discuss to pressure sensors. Purpose: pressure sensors measure pressure changes within the body, helping assess various physiological conditions. What is its applications? Intracranial pressure monitoring. Pressure sensors are used to monitor pressure within the skull, crucial for patients with traumatic brain injuries or other neurological conditions. Respiratory support. Pressure sensors are employed in ventilators to monitor and adjust airway pressure for patients on mechanical ventilation. Intraocular pressure measurement. In ophthalmology, pressure sensors help diagnose and manage conditions like glaucoma by measuring intraocular pressure. Next, what is the conclusion of therapeutic devices? In the dynamic landscape of modern healthcare, the significance of therapeutic devices cannot be overstated. Diverse applications and impact. From the early roots of heat and cold therapy devices to the cutting edge realm of robotic surgery and AI driven interventions, the spectrum of therapeutic devices is broad and impactful. These devices touch virtually every medical specialty, from cardiology to neurology, offering solutions that range from pain relief to life saving procedures. Integration of science and technology. Therapeutic devices embody the synergistic convergence of medical science and technology. They represent the innovation born of collaboration between medical practitioners, engineers, scientists and researchers. This fusion has led to devices that not only addresses medical needs, but also enhance patient experience, minimize invasiveness and improve outcomes. What are the challenges and ethical considerations? The journey of therapeutic devices is not without its challenges. We have delved into critical aspects such as patient safety, regulatory compliance and ethical considerations. These challenges underscore the responsibility of healthcare professionals and device manufacturers to ensure that devices are safe, effective and adhere to the highest ethical standards. What is the future horizons? Looking forward, the prospects for therapeutic devices are incredibly promising. Emerging trends such as AI integration, personalized medicine and advancements in material sciences offer a glimpse into the potential for even more precise, tailored and efficient treatments. We stand on the cusp of future where healthcare is not only proactive but also deeply individualized. And last we are discussed to human centric impact. Above all, let us remember that the true essence of therapeutic devices lies in their impact on human lives. Behind every device is a patient whose quality of life is improved, a healthcare provider empowered with enhanced tools, and a researcher contributing to the advancement of medical science. Thank you.